I want to thank the Lown Institute and Dr. Saini for this recognition, the Lown family, the board, and the Institute's unwavering commitment to getting us to the kind of medicine that Dr. Lown believed in. I am incredibly honored to receive this award for the work that is closest to my heart, work that is fueled by both love and rage, work that exposes the human suffering and health crises unfolding inside U.S. immigration prisons. James Baldwin once said, "Not everything that is faced can be changed, but nothing can be changed until it is faced." We are collectively witnessing the disappearance of friends and neighbors, the erosion of voting rights and democratic norms, the dismantling of public health protections, and the abandonment of families in their moments of greatest need. And beneath all this is a deeper crisis, the normalization of human suffering and indifference. Immigration violations are civil, like a parking ticket. An immigration hearing should never result in a death sentence. Yet every 6 days, immigration detention takes another life. 2025 was the deadliest year in decades for people in ICE custody, and 2026 is on track to surpass it by miles. These deaths are the predictable result of policy choices, and they are preventable. At a time when immigrant prisons are expanding, we have to confront the structural violence of detention as a medical and a moral emergency. Dr. Lown said, "If you can see the invisible, you can do the impossible." And for many years, the harms of immigration detention remained largely invisible. I became involved with medical advocacy for detained immigrants as a second-year resident during the first Trump administration. I had heard reports of human rights violations and systemic medical neglect, but I was shocked to realize the scale of the problem. For decades, the United States has been the leader in imprisoning immigrants, turning nearly 500,000 people through a vast network of for-profit jails and prisons that are often hidden in plain sight. Through a friend and community organizer, I came to understand its interconnectedness with our mass incarceration system, the perverse profit incentives that motivated imprisonment, and their shared roots in structural racism that disproportionately target Black and Latina communities. I soon realized that as a physician, I was granted access that few others had to these closed facilities to witness and document what was happening to people inside. Unlike their family members, I was able to spend hours listening to people describe being trapped in a state of limbo under unlivable conditions, untreated pain, inadequate care, and intense isolation. It became clear to me that detention didn't just strip them of their belongings, it also stripped them of their humanity. And each evaluation I did was an opportunity to challenge that. I want to tell you about one such evaluation. Abdi was a healthy, active 30-year-old who arrived at JFK in 2017 with a green card, excited to reunite his family, only to be falsely accused by ICE and detained for 17 months, missing the birth of his second child. When I evaluated him, I documented what detention had done to his body, months of ignored symptoms, weight loss, fevers, until he was finally hospitalized with sepsis and pleural tuberculosis. He begged to see a doctor for 10 days before anyone acted, and he nearly died. Abdi's case showed me how detention makes healthy people sick. But the coalition that mobilized around him of legal advocates, of organizers, and community members under the Bring Abdi Home campaign really showed me what community medical legal partnerships can accomplish, not just documenting harm, but fighting to end it. As a primary care physician caring for a predominantly immigrant community, I witnessed the harms of immigration enforcement policies every day in the exam room. I have sat and broken down in tears with a mother when we uncovered the source of her anxiety while trying to hold it together for her children, her young children, my daughter's age. She was also quietly making plans for their care in case she was taken by ICE. Alongside conversations about diabetes and blood pressure medications, I'm now finding myself counseling patients on how to recognize the signs of stroke in the event they're detained and denied access to their medications. These are heart-wrenching conversations to have. I can treat diabetes and blood pressure, but treating fear requires more than prescriptions. And I've been thinking a lot about fear and what it does to the body and what it takes to move through it anyway. A few weeks ago, my daughter Sophia fell and scraped her knee. It was not the worst boo-boo she's had, but for an entire day, she stayed curled up on the couch, too afraid to straighten her leg or to walk. We tried everything: ice cream, encouragement, turning off the TV, but nothing worked. By Monday morning, she was still too afraid to stand, so I sat beside her on her jungle print rug and asked her to take some deep belly breaths with me. With each breath, she imagined filling herself with braveness. Slowly, she stretched her foot toward a new animal on the rug, then another, and another. At least 10 minutes later, she stood up. Eventually, she limped out the door to school. She taught me something about the paralyzing power of fear. Not only for a child with a scraped knee, but for entire communities living under terror. Courage isn't the absence of fear. Courage is moving forward one small step at a time. The reality is that our current political climate is impeding our ability to practice evidence-based medicine on multiple fronts. For too long, we've accepted an unequal healthcare system that values some lives more than others. Confronting the structural violence of healthcare in America is quite literally breaking our healthcare workers. We talked about that today. So I found myself wondering, what is the role of the doctor without the ability to heal? And the answer that I have is that we refuse to look away. We organize. We use our privilege and power to expose injustices. Every act of collective care that keeps someone out of detention, every coalition that prevents a deportation, every story that breaks the public silence chips away at the system's legitimacy and necessity. In this moment of growing dehumanization, we have both the responsibility and the power to act collectively. To document the clinical consequences of policy, to accompany patients through fear, and to advocate for a healthcare system and country that recognizes our shared humanity. Our current immigration policies reflect how the lives of immigrants, and particularly immigrants of color, are valued less than the lives of others. But in the exam room, we have the power to counter that by bearing witness, centering their humanity, and creating space for justice. As necessary as presence in the exam room is, it will never be enough to dismantle what was built to exclude. Audre Lorde reminds us that the master's tools will never dismantle the master's house. And what we are witnessing is exactly what those tools were designed to produce. Doing the impossible requires radical reimagining, grounded in community, care, and justice. A world without ICE, where people can pursue their immigration case within their communities, free of cages. A future where immigration status no longer determines one's health or worth. We don't fight because we know we can win. We fight because there's too much to lose if we don't try. And I want to close by thanking my family for their love, their support today and every day. My husband for trekking with the kids. A minha avó, Silene, obrigada por tudo. My family. Dr. Oxides Barbeau for nominating me. Chad for being here today, and the entire United Hospital Fund Health Equity Fellowship team for cheering me on. I want to thank the NILP Health Justice team and my colleagues around the country who are fighting for their patients and the communities they serve every day. None of this work can be done alone, and thank you all for taking this next step with me.